Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Yes, hi. My name is Dr. Sachin Adukia. I'm a neurologist working full time at Hiranandani Hospital in Powai, which is in Mumbai.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Seizure is it is the result when one part of the brain or whole brain becomes abnormally active. It starts discharging greater amounts of stimulation and current than it should. That causes various parts of the body to become stiff, to rotate abnormally, and start jerking very violently. So, during this time, the patient's consciousness level is also impaired. He is not aware of his surroundings. He may even have uncontrolled falls. Various injuries can be seen in seizures. These include injuries like that to the face, to the teeth, injury to the tongue, because sometimes the tongue gets bitten in between the teeth. Besides that, there can be injury to the head, to the large joints such as the shoulder, backbone, hips, and so on. Seizures can
Okay.
affect Seizures can affect children right from birth up till very old people, including those in their 90s. The causes of seizure are different at various ages.
What is epilepsy?
When seizures start occurring repeatedly, it is called as epilepsy. When there is a single episode, it is called a seizure. But recurring seizures, due to some cause which is identified or unidentified, is called as epilepsy.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
No, in fact, the commonest cause of epilepsy is idiopathic. In common man's language, idiopathic means the condition where we don't know the cause or it is not found by us till now. That is called idiopathic. So, that is amongst the commonest cause of epilepsy, especially between the ages of 5 till 20. That is in school going and college going children. That is the commonest cause. Besides that, so this is called primary epilepsy or idiopathic epilepsy, where we do not know the cause. Of course, there are conditions where we do know the cause. So,
Okay.
let's say a patient has brain tumor, he can have a seizure. So that is called secondary epilepsy because the epilepsy is happening due to some abnormality in the brain. So it can be brain tumor, TB in the brain, parasite in the brain, some other infection in the brain, internal swelling, trauma, bleeding. There can be metabolic disturbances such as sodium level, sugar level, acid level in the brain, ammonia in the brain, urea, which is a function of the kidney. So there are structural causes, metabolic causes, vascular causes such as the bleeding, which I just alluded to, trauma, of course. Besides that, there are structural abnormalities. One may see special children or even normal children, but they may have small patches, small islands of abnormalities in the brain. So that island will trigger abnormally because it does not belong over there. Still, it is there, and all it does is create problems for the person, and that can give rise to recurrent seizures.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
So classically, epilepsy, there are so many types of epilepsy. Some form of seizures give a warning to the patient. So the patient knows that he has to take evasive action. He has to take a protective seat in the corner of the room or just stop walking, stop whatever he's doing because he knows that after this, a seizure event is about to happen. This warning is called as aura. Now, aura can be visual, various types of aura. Many people get a premonitory aura, wherein they know that there is an impending disaster, something bad is about to happen. While others, they have visual aura. Some others may have aura of smell, aura of hearing, and then they may have automatisms wherein their hands and legs start moving in uncontrollably. For example, they may start rubbing their nose like this for no reason, or
Yes.
it may be a gelastic aura where a person starts smiling. There may be a dacrystic aura where a person starts crying. So there are so many mm, warning features, and indeed, these aura merge with the seizure itself. So that is something which the patient can warn you about as a caretaker.
Face stigma. Can you tell us why epilepsy is often misunderstood?
Many people think that it is a genetic disease, and that the person is somewhat like, he's damaged or he's infected somehow, and he will pass on this to the next generation. So that's stigma, and they also feel that this person is getting seizures, so he must be mentally retarded. He might not have the same intellectual capacity. And the misfortune of our country is that all of these prejudices are severely geared against the female gender. Therefore, it
Hmm.
becomes very difficult for them during matrimonial searches and matrimonial times to convince the prospective groom and his family that this is just a medical condition and it can be treated and controlled like any other medical condition. There is no need to be afraid of it. But yes, the stigma is there. Fortunately, there are many organizations, including NGOs, healthcare organizations, our hospital, various pharma companies, which are also actively trying to break the stigma surrounding epilepsy. That comes by educating the people at large, uh, discussions, by holding discussions at community level, at the society level, in housing societies, or in various gatherings like those with old people, empowering women, many such gatherings. So slowly the stigma is fading away, but I think the challenge is there for us to face.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
The treatment for epilepsy depends on the cause of epilepsy, and it is also governed by various factors like the gender of the patient, age of the patient, what are the other comorbidities that the person has. So allow me to give an example of each of this. Firstly, I said it depends on the cause. Just yesterday, I had a 70-year-old lady whose sugar level fell down. She has diabetes and she could not eat food on time. So the sugar level fell to 40. So due to lack of sugar, the brain started having seizures. Now this person has a clear cause of seizure. If I correct the cause, I know I can prevent future occurrences of seizure. So I do not need to give long-term medicines for such a patient. On the other hand, if someone has a brain tumor, until I remove that tumor surgically, there is no respite. On the other hand, if someone has primary epilepsy, which means idiopathic, where the cause is not known or not identified, then I cannot ignore it, nor can I operate anything. The only option is to medicate. So these three examples highlight that we can either be conservative, or we can have medication or surgery. So this is depending on the cause. Then depending on the gender of the patient. Uh, Nature has given women the responsibility of bearing children and the next generation. So we have to be very careful not to give any medication to a lady of childbearing age, or even a teenage girl for that matter, which might have implications on her future pregnancies. Because, with all respect, we understand that two families fully depend on the well being of a female.
Hmm.
So Many treatment decisions are guided by that. Sometimes we know that this is the best drug for this epilepsy, but we cannot give it in a lady because it will have more than 95% chances of a complicated pregnancy. And we cannot allow that. Morally, ethically, and legally, we cannot. Then I mentioned about the age. Children have different metabolisms, so they cannot tolerate certain medicines. Likewise, older people also, they have some kidney failure, some liver failure, some cardiac issue, and due to that, some medications are limited. Coming to comorbidities, again, this mainly reflects about the older people when they have issues of the heart, issues of the kidney, liver, they cannot handle the same medicine properly. Plus, they are eating multiple other medicines. So, these medicines begin to interact with each other, potentially harming the patient. How does it harm the patient? Well, not directly. It harms by the fact that the level of the medication, it might simply go too high and cause problems, or it may remain too low. So even if you're taking the medicine on the recommended dose, you're not able to actually derive the benefit.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
Fantastic. So this is the most important question because it represents the patient's half of treatment. Uh, I always tell my patients that your treatment is a partnership where I will do 50% by educating you about your condition. I will give you the resources and the medication. That's my 50%. Your 50% is to do whatever instructions have been passed on to you. So, first, there are some do's and don'ts. More important are the don'ts. The person with epilepsy cannot engage in dangerous activities. Now, what are dangerous activities? Let me not be very specific and pinpointed, but in a broader sense, any activity which a parent can allow a 7 or 8 year old child to do without being afraid that he will hurt himself or hurt others, those are called safe activities. If they feel ki, even a 7 8 year old child cannot do this activity with responsibility, then it is a dangerous activity. Allow me to share some examples with you. Foremost example is driving, riding a motorbike or a motor scooter, uh, engaging in adventure sports such as mountaineering, trekking, rock climbing. Then you have swimming. Then you have using heavy machinery, and in some cases even cooking around hot oils. Cooking around a flame,
Yes.
that also can be extremely dangerous. These are the don'ts. Coming to the do's, first do is to please take the medication properly. Take it on time. You have to not only take it, but you have to take it on time. Second is you have to maintain good sleep. You have to stay away from alcohol. You have to avoid any sedatives, alcohol being one of them, but neend ki goli, for example, sleeping pills,
Yes.
because they also have the potential to accentuate the effect of anti-epileptics, or rather to accentuate the propensity of epilepsy.
Okay.
So do make sure that you get medication from a knowledgeable doctor whom you trust, who has some hold of the subject.
Thank you so much, doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Yes, indeed. I missed out a vital point which needs to be highlighted, and it is targeted to the audience because many a times when you see a patient having a seizure on the road, you become the audience. Now there are two types of audience. One is the one who does not help the patient because he or she doesn't know what to do. Whereas I intend that you should be amongst the one who are able to help the patient. So what can you do as an audience or as an onlooker when you see a person having a seizure in front of you? First is never to panic. Second, don't hold the patient down. People feel that he's shivering, he's jerking. Let us hold him down incredibly with force, which will stop the seizure. No, you will suffocate the person. Third is do not make him smell anything. You must have all seen that people run and get some shoes,
Yes.
some onion, some orange peels. Please do not do anything. Third is do not try to give anything electrical to the patient, rather metallic. What people think
Right,
is,
like a spoon.
yes, spoon key actually, because on the road you can
Hmm.
find a key in a pocket rather than a spoon. What people think that there is some electricity passing through his body. So let's give him something metallic so that the electricity will pass out. And that makes no sense. So this was about what not to do. Now the point is what to do. Wait for the seizure to get over. You have to remember S. So first is safety. Let's say that the person has a seizure in the stairs. So don't start treating him on the stairs itself. Take him on the plinth in the stairwell so that there's a flat surface. Or, for example, if a person has a seizure and is hanging half out of his chair, do not put him back on his chair. Lay him gently down on the floor with the help of others. So, first is scene safety. Second is sideways. Turn the patient sideways because many times they vomit. If they are turned sideways, the vomit will go out of their corner of the mouth. But if they are lying flat, that same vomit will go into their chest, causing very bad infections. So, sideways. Then look for some spray. Many times people have a spray in their pocket which can be given in the nose because that is the only path which is still open, right? The mouth is closed, everything is closed, so you cannot shove anything in the mouth. So, look for the spray. Last is stimulate. So you just start once the seizure is over, start rubbing the palms and the soles of the patient very vigorously and start tapping the palms and the soles gently. So that is what you have to do as a non-licker. If I may repeat, you have to remember all the S, safety, sideways, spray, and stimulate. If anyone else wants to help, tell them to just take a file or some newspaper and just, for example, just blow gently like this because the
Okay,
person
got
is
it.
feeling suffocated. He has no access to oxygen. On top of it, if you cramp him, he may have some very serious complications. So just leave the patient. Don't crowd him. Stay away. Only one or two people can help him, and that's it. Do not put any spoon in the mouth. If he's biting his tongue, let him bite. It's okay. Do not try to put your finger or some spoon or some other wooden thing because he may actually choke on that thing. So, yeah, those are the things which I can think of.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.